two topics during these 5 minutes. I will present the network of patient coalition at different levels, local, national, and European level. And I will present some agenda for this year, what patient coalition would push on. Now, if we take the local level, I show the example of Switzerland, there is about 25 groups of patients, not formally organized, but group of all the patients in the main town, Fribourg, Olten, Bâle, Zurich. At the national level, there were two formal organizations called associations, thanks to the law. The oldest one is Prostate. Prostate is an association to support patients and relatives attended by prostate disease. A younger one is PCP or PKP, Patienten Prostatakrebs in der Schweiz. Und we have organized at the national level the European coalition, Europa Uomo Switzerland. And there is also a very young Swiss patient coalition. All these things was possible with the support of, in Geneva, it's a Ligue Genevoise contre le Cancer, Geneva League Against Cancer, which make with us the hotline for French-speaking patients in Switzerland, but also in France, because we are surrounded by France. PKP and the national coalition, we are on the process to create a hotline with the Swiss cancer leagues, and we have this level well functioning. So we say union make strength. Now, at the European level, at the same time Prostate was created, Europa Uomo was created. It's about 2002, and we succeed to have a very formal collaboration with EAU, European Association of Urology, which allow all our delegates to attend free of charge their meetings. And we have the high privilege during our meeting, our steering strategic committee take place during the European meeting, and we have the pleasure and the privilege to have stars, urologists and oncologists to attend 30 minutes to our meeting and to give up-to-date lectures. So there is a very high dedication from EAU to provide quality information to the patient groups. We have also a very nice and formal link with Azo. European School of Oncology is a private foundation, non-profit, in Milano and in Ticino. They are dedicated for training nurse, physician, and patient advocate to better care. Thanks to these networks, patients certainly can express their voice. The patients are delegates. They are not for their own situation. They don't receive private consultants. They advocate. And sometimes physicians are reluctant to incorporate patients, but sometimes happen a patient say, well, in my case, and so and so. So we have to train physicians to behave as delegates, and certainly physicians have to be trained to better communicate. I will say that before. Now, very shortly, some agenda for this year. Quality of life is a major topic and has different acceptance. When you receive the diagnosis, the communication process must be well done, and certainly we have to train physicians. EAU has a major program now to train professionals to be good communicators. They know that poor communicators will disappear. It's no more possible to be a bad communicator. You have a very competitive physician. He's called Dr. Google. And, almost all the patients, and even patients are too old, their children, their family, their friends Google for that. So take that into account. Don't be afraid about the Google consultation. But it helps, because sometimes good information is available, but sometimes bad information. So that's why we have to work to certify good information on internet. And there is a strategy from the HON Foundation in Geneva, a non-profit organization. HON is Health on the Net, certifying internet website with a lot of criteria called the HON Code. Quality of life, okay, is something very important for patients, as you know. They thrive to survive and to... quality of information is also important. I will just mention a small vignette. A patient was treated under pressure from his surgeon. Say, I have a place for you, thanks, in the next 10 days. No information. After the treatment, the patient, that's a real case in Geneva. After the treatment, the patient was impotent and was incontinent.
We don't make any coffee. Yes, I know.
He waited for months, and the situation was not better. And say, why you have not informed me? And it was a struggle, a war between the two. And finally, the physician says, you don't need a penis to walk. Please reflect about this kind of communication. The patient decides to suit the physician, and we don't know the result. But that's an example. By chance is not the majority. Early and smart screening is something very important for all of us, because we think by prevention we can save life. You know the discussion about this, but we are completely engaged, and to make awareness of that. We're also engaged for active surveillance, knowing that this strategy is not an easy strategy. We have to balance curability and quality of life. We are completely aware of that. And we make good lobby for what is called prostate units. In Switzerland, there is only one center certified on the strategy coming from Germany. Germany has 25 prostate centers certified. So we believe that physician working alone will disappear. It was many times mentioned during this great meeting that we have to work in teams. So working in teams is something we must learn. It's not an easy. We don't like to work with other people. We say, it takes too much time, I can do alone, but it's, I think, the time where a patient was treated by an alone surgeon or physician is over. This kind of meeting, for example, that's an Azo Workshop attended in Rotterdam. Thanks to our relation with this organization, we can attend free of charge. That's a privilege, but also a responsibility to share information. And physician society has decided to use patient advocacy group to share information. Is a way to distribute information. This is a reference paper to discuss prostate unit. It was published. This guy is the president of the scientific committee of AOS, Riccardo Valdiani, and they discuss in that paper, it's a 6-page, the criteria of prostate unit. They are completely inspired what is going on in Germany. So please read this, and we will discuss that during that year, because we think it's a good way to make progress. Now, this waterfall don't need some pharmaceutical, it just needs energy, but it was in blue. For the first time last year, in September, the Geneva waterfall was in blue. Only in night, because September is the international month for prostate disease. On the 19th September this year, we will celebrate EPAD, European Prostate Awareness Day. It is on the same time as the Urological Week. And I thank you for your attention.
Thank you very much, Dr. Griesser. I think as we are a little bit short of time, we'll go on, and if there is any question, they can talk with you during the coffee break. Now we move.